Hey guys, Ralph Havens here, Beyond Limits Physical Therapy in Bellingham, Washington. Just finished a great run on the Lower Ridge Trail and Fragrance Lake Trail here in the Chuckanut Mountains. And I was thinking of talking about the type of therapist you get. And I'm talking about anybody, whether you're dealing with a medical doctor, a natural doctor, massage therapist, chiropractor, physical therapist, me, integrative manual therapist, physical therapist, even talk therapist. I'm going to put those people in the same category, dealing with mental, emotional stuff, all sorts of relationship stuff. What I've noticed is to find a good therapist, there's a very, very key thing that we use. And I've trained in this many, many years to get this way of thinking about things. When you have somebody with a problem, it's good to know what the solution is. Like if something were to be done for this person, what do they want? Like, do they want a knee to feel better? I just saw a runner here that's dealing with knee pain that we were talking about possible causes. What do you have that's going on? If it's a relationship thing, what's the solution? Like if you could have the solution presented to you and done, if you could get what you want, even with relationships, what would you want if you're seeing a talk therapist? With back pain, neck pain, what do you want? You want to get rid of your shoulder pain, your ankle pain? What do you want? And then when you see the practitioner, they do something, an hour of treatment or whatever they do, whether it's physical therapy, chiropractic therapy, massage, talk therapy. When they're done, are you different? And I mean, even with the talk therapy, we have a technique we call the original process. It's been called many things. It's in a lot of spiritual traditions. And it gets rid of, it shifts the mental, emotional anguish, the overwhelm, the stress that can be the cause of a lot of injuries. So a lot of pain, chronic pain. So when we do that technique, which is not a physical technique, it's called somatic listening technique. When we teach the person to do that, we can retest right away, and we've seen knee pain go away in the hour of them doing that treatment. We've seen ankle pain go away. I've seen shoulders improve in range of motion after an hour of that type of work. So whether you're dealing with a physical thing or a mental, emotional thing, my suggestion is you should test something and then retest it and see, are you different? And if you're not, and you're not over the course of days or weeks or months or years of seeing people, you might be in the wrong place. And by that I mean, do you know, as a therapist, as a doctor, as a, whatever type of therapist you are you looking in the right place? Are you in the place that has the cause? Do you have the right key for that lock? And you'll know it by the result. And so one other way to tell, if you ask your therapist, whatever kind of therapy you're getting, my suggestion is, hey, do you know what my solution is? You know what my goal is? And if they can't, after they've been seeing you for days or weeks or months, if they can't tell you what your goal is, that says a lot. Because I've actually talked to some people that I'll just leave it at that. It's one of my pet peeves, because I think the therapist and the client should have a goal that's tangible enough that you can tell if it works. So let me know what you think. Send me any messages. Let me know what's going on with you. And let's get out there and live. Let's really live. All right, you guys, signing off from Fairhaven, Bellingham, Washington.